agents really need to hear this now, and a lot of agents are really struggling. So we got some of the top experts in the industry on telesales and different stuff offering advice and tips during this time with the coronavirus. And so we know a lot of you agents have been affected. In fact, the whole world's been affected by this. And so a lot of things are changing. Everything's in flux, new news every day. I know it's quite all over everything. So, and a lot of people are staying home. So on face-to-face, that's getting a little tougher, especially if you're working a senior market. It's dangerous for them to be meeting with people right now. And so now is the great time. People are at home, people are answering calls. Don't be, predatory about it or anything, but they are thinking about life insurance. They're thinking about their health. They are sitting at home and have some time. And now's the time to reach out and talk with them, start conversation. We have a bunch of free resources for you guys on the site. Just go register there and you'll get access to a whole bunch of different free things. So go ahead and take advantage of those. We've managed to curate and also create ourselves a bunch of different stuff for you guys. I don't know if you've heard of My Telemedicine, but it's a virtual telemedicine company that we have agents in the group participating in, and they actually now are doing coronavirus assessments through that as well. It's super affordable, and you can sign up for an affiliate for free. Offer people that are at home that going to the doctor is a high risk for them, and it's very affordable, and they get unlimited 24/7 access to book doctor's appointments and different stuff through there. But they can also be assessed for the coronavirus while at home without having to go to the doctor, which is huge for people right now, especially the elderly community. Next guest coming up, Luis Moreno from the Insurance Squad. And I know you guys also do telesales. I know you guys got some content, a bunch of stuff coming out right now on that as well, and especially on the Medicare side. So I'd love to hear your general thoughts about telesales in general, some tips and advice for that. And if there's anything Medicare specific even with that, I think that is all very pertinent and relevant information during this time.
So, well, good. Well, I'll tell you a couple of things. Number one, Medicare has not stopped. At this point, we're still rocking and rolling. Even yesterday, I had some seniors come in and, they have a little bit of fear. We're not shaking hands. We're across the desk. I have a little bottle of hand sanitizer on my desk, and they're seeing me sanitize and trying to do whatever we can to prevent the spread. But there are a lot of seniors that are panicking, and they don't want to meet with seniors or with the agents. So as far as the telesales is concerned, it's a little fluid right now. Carriers are scrambling right now how to get agents in a position where they can do 100% telesales. And as we're speaking, I'm getting emails from carriers that they're having certifications on how you can do telesales. Now, and that's pretty much where you handle the entire thing done over the phone. We have the ability, and we've always had this ability, to remotely sell. Okay, but that's with them acquiring either a signature using Dropbox, they're typing their name on there on the email that they receive from a carrier. That has always been in place, but now trying to go completely telephonically is something new. It's out there for bigger agencies that have the platform where they're completely recording the conversations, but now individually for an agent, it's new. So I would tell agents, if you're with whatever carrier you're certified with, pay attention to your emails. Okay, because I got one yesterday from Aetna. I got one today from Humana. They all have different. They're trying to figure out how to make this happen. So it's not an easy thing. I will tell you, if you're going to do something telephonically with an insured, okay, some carriers are going to require you to record the conversation. There was two that I confirmed with this morning. Allwell and Aetna. They use a platform called Ascend, and you can acquire the scope. You can acquire the application, but everything can be done telephonically. But you have to record the conversation. There's a little toggle on the app that you've got to turn on to record your conversation. As far as your presentations are concerned, they still have to be 100% compliant. You've got to get to the insureds all the required information that's in an enrollment kit. And so you can't deviate from that. And so they must have it all. and nothing really changes. It's business as usual. It's just the way we acquire the signature. There's nothing additional that they have to do. They have to do what they've always been trained to do. Okay, they've got to acquire that scope before they start talking product. They've got to get that permission. So number one, you don't get the scope, you're going to have some issues. Second thing is make sure that you're doing your complete compliant presentation. Don't leave anything out. The only thing now is that instead of doing it face to face, of course, you're doing it over the phone. And I always tell the agents that we work with, order paper kits. Okay, seniors love to hold on to something. Yeah, some are technology friendly, but the majority of them are not. They want to touch something. So I always train my agents, get the kits, put them in front of the senior, and then use your pointer, whatever, as you're pointing to the kits, as you're reviewing the summary of benefits with that insured. You're doing it over the phone now. But I tell agents, if they don't have the ability to receive email and receive your entire enrollment kit by email, go to their house and drop off the kit. You've got to have that. They have to have that kit. It's that simple. The other things that we tell agents to do, whether you're face to face or you're over the telephone, you cannot do the two things that I see agents getting in trouble with. You cannot process an application without checking their doctors and checking their prescriptions. Okay, so you got to do it whether you're face to face or you got to do it telephonically. It's still the same process. So HIPAA, everything else. We're in a that right there. And you brought up a good point. HIPAA. They tell you, well, you're not supposed to ask for doctors and meds. Well, how can you recommend a plan without having that information?
Yep.
you're caught. I mean, I tell you, just don't be throwing out a plan to an insured without making sure that their doctors are in the network, specialists are in the network, and most importantly, that their prescriptions are covered in the formulary. I don't want to put an insured into your plan XYZ, and then all of a sudden that med that they're taking is not covered the following month. Man, I'm going to get a call from an angry insured, and I definitely don't want that's the least of their problems. The problem is they need their meds, and if it's not being covered, yeah, I train agents. You got to have that information before you make a recommendation.
Absolutely. You got to be able to help advise and put them in the right spot. Absolutely. And if you're, dropping off the plan documents and everything with them, that's a good time to drop it, at their door, at their mailbox, and, kind of let them know that you've dropped it. And if you got some hand sanitizer or a roll of toilet paper, maybe drop that as a gift as well when you drop it off. But
why not? Hey, those are commodities right now.
Those are heavy ones. Yeah, I don't know if that's a violation. I don't know if the price of hand sanitizer may not be Medicare compliant at this point. Well, so I don't know.
I tell you what, this is new. How do you put a price on a bottle? I have this bottle here with me.
I feel like we shouldn't be going by gouging prices, deciding what's compliant or not. So I think giving them a bottle of hand sanitizer should be okay. So if you have it, it's like liquid gold right now. So
if you're leaving a roll of toilet paper too, I think you're going to be fine. So,
yeah, absolutely. So you're
going to be under that $15 limit. But
that's what I'm asking, for agents that, hey, this is the time I want to start doing a little bit of telesales now that I'm at home. My prospects are at home. How long does it really take for agents to, get set up and doing telesales in your experience and get rolling, and any kind of key tips on the difference from the face-to-face versus telesales on the Medicare side, even specifically, if you have any specifics there?
It's what extra you have to do. Like I said, it's very fluid. Today I got 2 emails. Humana is hosting a webinar, and all you've got to do is jump on their webinar and then I believe it's I'm going to pull it up here as we're talking. It is, let's see here, want to learn how to enroll over the phone. And so they have their telephonic enrollment process. And so it looks like it's a 10-minute meeting. So you do that, and I think you're rocking. With Aetna and with Allwell, you're going to use their Ascend platform. Okay, on that one, they want you to do a webinar, and then you have a quiz that you have to take at the end to pass in order to be certified to sell over the phone. United Healthcare, as far as I know, doesn't have that option yet, but you do have the ability to remotely acquire a signature. So when you're on their lien application and you're doing the app, you're processing the app, you can remotely send them the scope of appointment, and they can sign on their phone using Dropbox, super easy. And then they can also do the application. So that's what I would do with United. And those are my major carriers. So I don't think it's something, a whole nother day of training you've got to do. You've just got to do, pay attention to those emails, sign up for those webinars, get that done so that you're certified to sell over the phone telephonically. That's a little bit different. This is where you're not acquiring a signature. Okay, it's a little bit different. When you're with United, Humana, you're acquiring signatures, whether they're typing it in on the Fast app or the enrollment hub where they're signing with their finger on the screen. With United, they're signing their finger on the screen. That's different. We're talking telephonic, 100% telephonic, no internet, but can't deviate away from them having the enrollment kits. It is a huge must.
Absolutely.
Whether you drop it off or email it. I mean, if you're emailing it, well, you might as well do the acquire the signature with whatever carrier you're doing. Just get that signature. It seems pretty easy to me. I mean, my business hasn't slowed down one bit.
Awesome. So, have you seen anything with the carriers and anything with insurance companies during this time with what they're doing for the clients and the clients out there? Are there any changes with Medicare, Medicare supplements, or any of that sort of stuff right now with everything going on, or is it kind of just business as usual for the most part?
It's mainly business as usual, other than they're saying they're going to cover all the testing for this pandemic that's going on. Okay, so if insureds are freaking out and they want to get tested, what they're doing is they're saying, hey, we're going to cover it. Don't worry about it. Get out there, go get tested. The problem that I'm seeing, and I have a neighbor that's in the medical field, is there's not a lot of tests out there. I mean, what she's telling me is you've pretty much got to be on your deathbed before they're testing you. What they're saying is that if you're showing symptoms, quarantine yourself at home. We don't have a treatment. And so I would say, if they feel that they need to get tested, then try to get to your doc and see if they've got some form of testing. But here in San Antonio, Texas, there's a shortage from what she's telling me. And so there's not a solution yet or a problem. Hey, you got it. Quarantine yourself, do what you can to minimize the spread of it. And but as far as what the carriers are saying, they're going to cover it. Go get tested. Go to your doc. Go to your primary care doc and get that test if they're out there, if it's available.
Absolutely. And if you aren't necessarily showing symptoms or beginning showing symptoms, there may be virtual ways to, like my telemedicine now, I think there's been big press blowups over that they now have where they can do coronavirus assessments online with the doctor there rather than going in where seniors are very susceptible until they or at least then recommended to go in, because you don't want to go in and then catch something when you weren't sick in the first place. So I think it's really important to highlight here, especially since we're talking about Medicare, a senior market. It's very important that you're protecting that community in the senior market here. They're the most susceptible to everything, and you may not be high risk, but they are high risk. And so keeping that social distancing in mind, if you're dropping something off, make sure you kind of keeping distance, not touching them, and them if they're most people have their offices closed, but if they are coming in, just make sure you keep all of that in mind, hand washing, sanitizer, everything, because they are the most susceptible out there, and we need to do our jobs to protect them as well. So that's why we're talking about telesales a bit, and the opportunity there that can help protect them, but still help serve and help sure they have the right coverage and are enrolled in the right plans at the same time. So nothing has to slow down. They can still get the help they need. Absolutely.
I agree. I interviewed an agent. We have a conference call that we host every Tuesday, and my agent of the week this week, she's still doing home appointments. No issue. She's not stopping. And the only thing she's changed is she walks in the door she's asking every senior, hey, can I go wash my hands? And they're like, sure. And they're showing her the restroom and she's washing her hands. So she's making it very obvious that she's trying to do what she can. Having this, everybody here in my office has this sanitizer. Not that I don't have anything to do with these guys, but
man, you guys are rich. You guys all got sanitizer.
They walk in exactly, man. I should have bought some stock. But
well, actually, you might want to wait a little bit for buying the stock. But yeah.
But you know what? Just do what you can. Make it obvious that you're trying to sanitize yourself. We're doing the instead of the fist bump, we're doing the elbow bump, and but you know what? My office is open. People are walking in, and we're trying to keep our distance. But I really think it's business as usual. And if you're going to meet with these seniors virtually, whether it's by the phone or the internet, okay, document as much as you can. Whether you're taking hand notes, if you're going to drop off a kit, how do you prove that you dropped off a kit?
Take a picture.
Exactly. Take a picture. Hey, take a picture of their front door with their address on it. Take a picture. Yeah. Document that you left a kit, because if a complaint comes around and says, well, I was never given anything, you need to CYA. So document. If you have a way to record your call, if the carrier that you're going to be working with doesn't require it, self-record it. That's another thing. I know a couple of agents have their ability to record conversations. So record your conversations. I would also make sure you're documenting on whatever method that you use to document your info. Document the fact that you're checking their doctors and you're checking their meds. That's the biggest issue that I see. If you take care of that, you're going to eliminate 99% of a potential complaint.